They come through usually late teens or early 20s, but I've had them come through on people in their 60s. It's just a matter of the remoulding of the face over the life creates a path for the teeth to come out. On x-rays, there's specific indicators that we look for. We look to see whether or not they're likely to cause damage to adjacent teeth, whether there's evidence of damage to the bone where they're sitting. There's also issues when they over-erupt, sitting too far into the bite and causing areas of decay in other teeth. So in short, there's a lot of reasons why we might suggest they come out. It's not a given. A lot of people will get them, and particularly people that have had orthodontics where they've had teeth removed to align their teeth. They quite often have adequate space for the wisdom teeth, so they won't need to get it done, or they may. Bit of a lottery depending on the size of your face, and they'll quite often say that the teeth have been coming through and then going back and coming through and going back. The teeth don't come through and go back. What usually happens is as the tooth emerges, the gum swells around the outside of it and then creates pain, dissipates, and then it goes back down again and then it swells up. So it gives the impression that the tooth's coming in and out, but in actual fact it's just the infection recurring. To get them through and get them out of pain, we can give them antibiotics. We can also clean around the crown of the tooth, but almost invariably these teeth, if they're impacted, they won't be able to clean them properly, and they'll get recurrent infection, likely recurrent pain. It might happen once a year, it might happen once every 5 years, but the pain is not necessarily the indicator of the infection. Pain is an indication when there's a build-up of pressure. The infection can sit there chronically eating away at the bone around the top of the tooth. So the absence of pain in wisdom teeth is not necessarily the presence of health. Depends on what we can see in the mouth, how calm the patient is in the chair, whether or not the teeth are erupted, which means that they're in the mouth visible, or whether they're buried, how close they are to certain nerves, that sort of information we need to know before we can sort of direct them. As a general rule, I don't touch anything where it's near the nerve. The potential complications from that procedure warrant specialist attention, so we refer that. As far as assessing where is the most appropriate place to treat, if a patient is comfortable in the chair and they're happy to have local anaesthetic needles, generally speaking the procedure doesn't take that long. We allocate a fair amount of time, but if all those indicators are right, happy to do it in the chair. We also have an alternative of doing a twilight sedation, which is we take them down with IV sedation. In about 95% of patients, they have no memory of the procedure, so it's kind of like they've been through a GA, but there's less downtime at the end of it. During the course of that procedure, they're sort of half asleep. People doze in and out of sleep, but they'll usually respond if I ask them to open their mouth wider, and then we can get them out in that context. People that are less nervous or less anxious, we do an oral sedation. And if you can sit in the chair and you're happy to be numbed up, and we don't need to go deep into the bone or anything like that, then oral sedation is usually fine. Historically, we've tried to do them on Fridays because it gives people a weekend to recover. But that being said, if it's been uneventful, the next day they're usually fine. There is a complication that can sometimes develop called a dry socket, which tends to come along 2 or 3 days later, and that's a painful healing process, I guess. Assuming that doesn't happen, and that happens in about 1 in 30 cases, then there's no reason why a person can't be at work the next day or the day after. If you're having all of them taken out at once, I would probably recommend giving it at least a solid weekend. I would be surprised if I didn't take out maybe 400 wisdom teeth last year. Yeah, I do it all the time.